Welcome to The Explainer. Today, we're talking about something that affects millions, diabetes. But we're not just sticking to the basics. We're going to dive deep into the ripple effect and really understand how it impacts, well, pretty much the entire body, from the tiniest blood vessels all the way to your major organs.
All right, so let's get right into it. The big question is this: what really happens when your blood sugar stays too high for too long? Because diabetes is so much more than just checking your glucose levels every day. It's really about stopping a whole cascade of problems, a chain reaction that can spread through your entire body. And to really get a handle on this chain reaction, it helps to think of it as splitting into two main paths of damage, two totally different ways that diabetes can become a major threat.
So on one path, you've got the acute stuff. Think of these as sudden explosions, serious medical crises that hit you fast. Then on the other path, you've got the chronic problems. This is more like a slow, silent erosion, damage that builds up quietly over years and years. Both are incredibly serious, but they play out on totally different schedules.
Okay, so let's tackle those immediate threats first. We're talking about the fast-moving complications, the ones that are an all-out emergency and signal a really dangerous imbalance in the body.
First on the list is something called diabetic ketoacidosis, or DKA. This is a full-blown, life-threatening emergency, and you see it most often in type 1 diabetes. Basically, without enough insulin, the body can't use sugar for fuel. So what does it do? It panics and starts burning fat like crazy. The problem is, this process creates these acidic byproducts called ketones, which flood the blood. And that stat at the end, wow, it's the #1 cause of death for diabetic patients under 58. That's serious.
Then there's HHS. It's kind of like DKA's cousin, but it shows up more in type 2 diabetes. Here, the blood sugar levels just go through the roof. We're talking sky high, often over 600. This causes massive dehydration and can lead to really scary neurological problems, like confusion or even a coma.
But it's not always about high blood sugar, right? You can't forget the flip side, severe hypoglycemia. This is when blood sugar crashes to dangerously low levels. We're talking seizures, passing out, and tragically, it's responsible for as many as 10% of all deaths in people with type 1 diabetes.
Okay, so that's the fast and furious stuff. Let's shift gears now and talk about that slow, silent attack. This is the part of the chain reaction that creeps up on you over years, and it all starts in the body's absolute tiniest blood vessels, what scientists call the microvasculature.
One of the first places this ripple hits is the eyes. All that extra sugar in the blood starts to wreck the delicate little vessels in the back of your eye and the retina. This is called diabetic retinopathy. Those vessels can start to leak, or the body tries to grow new ones that are super fragile and just bleed easily. And all of this, as you can imagine, puts your vision at serious risk.
And check this out. The real-world impact is just staggering. This is not some minor side effect. Diabetic retinopathy is the #1 reason for blindness among working-age adults. That just goes to show you how devastating this small vessel damage can really be.
All right, the next ripple spreads to the kidneys. And it's a really similar story to the eyes. The tiny blood vessels that act like little filters in your kidneys get all beaten up. This is diabetic nephropathy, and it's not an all-or-nothing thing. It moves through 5 clear stages, starting with a little damage and ending in total kidney failure, where you'd need dialysis or a transplant just to stay alive.
And the last piece of this micro-damage puzzle is nerve damage. Those same tiny blood vessels that feed our nerves get choked off, and that leads to diabetic neuropathy. You might have heard of this. It's what causes that awful pain, tingling, or sometimes a total lack of feeling, usually starting in the hands and feet. And it is shockingly common. We're talking over half of all patients have it after just 10 years with a diagnosis.
But wait, the damage doesn't stop there. It doesn't just stick to the small vessels. As that ripple effect keeps spreading, it starts hitting the big leagues, the body's largest arteries and blood vessels. And this is where we get into some of the absolute most life-threatening problems.
The biggest threat by far is to the heart. Diabetes basically puts the process of hardening of the arteries, atherosclerosis, on fast forward. Plaque builds up way quicker. This is coronary artery disease, and it is the single biggest killer of people with diabetes. So let's just put that into perspective for a second. Having diabetes means you have a 2 to 4 times higher risk of dying from heart disease than someone who doesn't. That just completely changes the game when it comes to your heart health.
And it's not just the heart. That same damage extends to the arteries that feed your brain. And you can see it right here. The risk of having a stroke shoots way up. It's especially tough for people with type 1, who are looking at a risk that's 2.5 times higher than everybody else.
Okay, now here's where things get really dangerous. This is the point where those two paths of damage we talked about, the small vessel and the large vessel, can crash into each other. And the place where this collision often happens? It's the feet. This quote here really says it all.
Just think about it for a second. You've got nerve damage from the small vessel problems, right? So maybe you get a small cut or a blister on your foot and you don't even feel it. But then you've also got poor circulation from the large vessel problems, peripheral artery disease. That means the cut isn't getting the blood it needs to heal. It's the absolute perfect storm for a nasty ulcer that just won't go away, gets infected, and, well, that's how amputations happen.
So after hearing about all these pretty scary risks, from these sudden emergencies to that long, slow damage, the big question, the most important question, is can we do anything about it? Can this chain reaction be slowed down, or maybe even stopped in its tracks?
And the answer, thankfully, is a big yes. But here's the key. It's not just about blood sugar. You have to look at the whole picture. The huge majority of people with diabetes are also dealing with high blood pressure and high cholesterol. And tackling those issues is every bit as important as controlling your glucose. And this right here, this is amazing. It shows you the incredible power you have. The research is crystal clear. For every single 1% drop in your HbA1c, that's that long-term blood sugar measurement, your risk for any diabetes-related complication goes down by 21%. That is huge. And it gets even better. When you look at that small vessel damage we were just talking about, the stuff that affects your eyes and kidneys, that same 1% drop in A1c, it leads to a whopping 37% reduction in those specific complications. So what does this all mean? It means that, yeah, this ripple effect is dangerous, but it is not a done deal. Just understanding how this all works, that's the first and most powerful step you can take to stop it from happening. Which leaves us with one last, really important thought. We've mapped out how the damage happens. We know that getting those risk factors under control makes a massive difference. So, what's the next grave frontier? What's it going to take? New drugs, new tech, a totally new approach? To finally stop this ripple effect before it even starts?